What is a chest tube and why is it used? A chest tube is inserted into the pleural space. It removes air, blood or fluid to allow lung expansion. Commonly used in pneumothorax, hemothorax or after chest surgery. What should be monitored in a patient with a chest tube? Drainage amount and color, presence of bubbling or air leaks, respiratory status and oxygen saturation, dressing condition and tube position. What are the common postoperative complications? Infection at the surgical site, bleeding, deep vein thrombosis, DVT, pulmonary embolism, delayed wound healing. What is the preferred site for checking pulse during CPR in adults? Carotid artery. What are the signs of effective CPR? Visible chest rise with breaths, palpable pulse during compressions, return of spontaneous circulation, ROSC. What should be done if chest does not rise during rescue breathing? Reposition the head using the head tilt chin lift method. Check for airway obstruction. Attempt rescue breath again. What is defibrillation? It is the delivery of an electrical shock to the heart, used to correct life-threatening arrhythmias like ventricular fibrillation. What is CPR and when is it used? CPR stands for cardiopulmonary resuscitation. It is used in cases of cardiac arrest to restore breathing and circulation. It includes chest compressions and rescue breaths. What is the compression to ventilation ratio during single rescue or CPR in adults? 30 compressions, 2 breaths. What should be the ratio of compressions to breaths in 2 rescue or CPR for children? 15 compressions, 2 breaths. What is the ideal rate of chest compressions during CPR? 100 to 120 compressions per minute. What is the purpose of a Foley catheter? To drain urine from the bladder continuously. How do you check for proper placement of endotracheal tube, ET tube? Auscultate for bilateral breath sounds. Check chest rise. Confirm with capnography or X-ray. What is the color coding of a 20 gauge IV cannula? Pink. What is the antidote for paracetamol overdose? N-acetylcysteine, NAC. What is the first nursing action after a fall in the ward? Assess the patient's level of consciousness and vital signs. What precautions are taken for a patient with tuberculosis? Airborne precautions, N95 mask and negative pressure room. What is the antidote for heparin overdose? Protamine sulfate. What are the complications of uncontrolled hypertension? Stroke, heart attack, kidney damage. What are the early signs of increased intracranial pressure? ICP. Headache and vomiting, decreased level of consciousness, blurred vision or double vision, unequal pupil size or slow reaction to light, abnormal posturing or seizures. What precautions should be taken when giving medications through a feeding tube? Verify tube placement before administration. Crush medications only if safe and approved. Flush the tube before and after giving the drug. Avoid mixing multiple medications together. What is the function of the AV fistula in dialysis patients? It provides long-term access to the bloodstream for hemodialysis, created by joining an artery and a vein. Allows repeated needle insertions with high blood flow rate. Reduces the need for temporary catheters. What are the signs of intravenous infiltration? Swelling and puffiness at the IV site, coolness and paleness around the insertion area, pain or discomfort at the site, slowed or stopped IV flow. What is the correct method of cleaning a wound? Wash hands and wear gloves. Clean from the center of the wound outward using sterile gauze. Use a new swab for each outward stroke. Avoid reusing the same swab on the wound. Apply appropriate antiseptic and dressing. What is the correct position for a patient during a lumbar puncture? Lateral recumbent position with knees drawn to chest. Fetal position. Helps open intervertebral spaces for easy access. Alternatively, sitting and leaning forward on a table can be used. What should be done if a patient develops a transfusion reaction? Immediately stop the blood transfusion. Maintain IV line with normal saline using new tubing. Inform the physician immediately. Monitor vital signs and symptoms. Send blood bag and tubing to lab for investigation. What are the legal responsibilities of a nurse? Maintain patient confidentiality. Obtain informed consent before procedures. Document accurately and honestly. Follow institutional policies and nursing standards. Report errors or incidents promptly. What are the causes of bed sores? Pressure ulcers, prolonged pressure over bony areas, friction and shearing forces, moisture from sweat, urine or feces, poor nutrition and hydration, limited mobility or unconsciousness. What are the contraindications for oral medication administration? Patient is unconscious or semi-conscious. Patient has difficulty swallowing, dysphagia. Patient is vomiting. Gastrointestinal obstruction or surgery involving GI tract. NPO, nothing by mouth orders from the doctor.